morning. Yeah, so we'll start today's class. And what we had in last few classes, we spoke about introduction. Okay. Can we have a quick recall of what was done in last few classes? We spoke of symptoms. Yes, very good. And we also spoke of types of symptoms. And then I introduced you to something called as sources. So many symptoms, from where are we getting? What is the source behind so many homeopathic symptoms is what we tried to explore in the previous class. Very good, agreed. And then we also spoke of the last topic, which was very important, and that was different types of homeopathic materia medica. And to make it simple, we classified the materia medica into two types, modified and unmodified. And modified is what an author, after the drug proving, he modifies according to his knowledge, according to his convenience, and he will present it to us. And there was one more materia medica we discussed, and it was unmodified, where the author is not changing, the author is not modifying, and the symptoms are mentioned as told by the prover, or by the prover basically. So these were the two varieties, and in this class you will understand the importance of all we studied in last few hours, and we'll start with a remedy. Okay, now there are three important words that as a first year student you need to remember. One, there is something called as a drug. Second thing, there is something called as a medicine. And third very important thing is there is something called as a remedy. So three terms you need to understand, and we'll move further. Okay. Now what is a drug? It is a crude form. Okay, good. Like for example, homeopathically if you see what you give to a prover. Okay. And what is a medicine? Okay, when it is potentized, then it becomes a medicine. And when is it called a remedy? When the medicine gets indicated. Okay, when the medicine gets indicated, we call it a remedy. Okay. I'll just share a simple drug is what we'll try to explore. Now before that, I'll just share a small situation. Hopefully 3-4 days back, one evening, 4 days back, that evening, one of my colleagues had called telling her 2 years old young daughter, okay, a neighbor's cat had scratched her forehead and it was bleeding. So it was a panicky call I got during my clinical hours. What was the situation? What was the situation? Like, one of neighbor's cat, scratches the baby and the baby's forehead is bleeding. Okay. So this was a small situation. I got a call, and what exactly we do in this situation is again very, very important. Okay. I know I am dealing with first years. I can't expect what exactly you do or which is the medicine you are going to prescribe, etc., etc. Okay. But I want you to keep this situation in mind. As and when we start unfolding the remedy, you will slowly realize what remedy was given, why that particular remedy was prescribed is what you will slowly understand. Okay. So this is a small situation. Now before we start the class, I again have a small question. How many of you ever had a fall or an injury? It's a question. Yeah. Many of you. Yes, plenty. I see slowly the hands raising up. You're looking into your friend. Oh, she is also raising. Let me also raise. Now the question is, how many of you had an injury? Okay. And what type of injury you have had? When I say injury, what was the type of injury you have had? You could have? Okay, you could have fallen. Okay. You could have had a fall. Very good. You would have bruised yourself, possible? Yeah, one of our friend had met with an accident that resulted in an injury. Okay, possible, good. Fractures, yes. Fractures where the bone got injured. Okay, so what you need to understand is you have all had injuries. Okay, it could be a minute one or it could be some serious one. Okay, and if you look into our traditional way of treating injuries, if you have had grandmoms, grandparents at home, you know what is the simplest thing they do when you have an injury? They put turmeric. Beautiful, good. They put turmeric, or if you are lucky, if you have a garden around, or if you have some plants, some herb, your grandmom, your dad, whoever it is, can make a mixture of that. Fine, you can make a juice of it and apply it or bandage it. Okay. So what I want to try to tell you here is, from the history, we know that there are few herbs which we have been using in treating injuries. This is what we know. Now, whenever I am telling some word, what is it you need to understand is, whatever information I am giving, that information has to be linked with the classes I have done in the past. Are you with me? Done? So what is this source that we are trying to talk of here? We are talking of a source which is empirical. Now what is an empirical source? Empirical source is a traditional source, a source which comes with experience. Okay. So you know this herb is used for injuries because your grandfather had told, for him, his grandfather would have told, and it has been running through generation, and it is a traditional source. Okay. So the remedy that we are going to discuss today is a remedy, the medicinal properties of which people already knew. Okay. Before we started taking it up into homeopathy, it was a famous remedy before. Okay. Now what was this remedy used for? See, in olden days, this remedy was used for freeing oxen and pigs from lice. Okay. The leaves have a strong smell which keep off lice and prevent flour from getting moldy. Okay. These are all the traditional uses of this particular remedy which we are going to discuss. I am yet to name the remedy. Don't worry what I am going to tell. I know it is your first material medical drug. Go slow, try to understand. Okay. And second thing, in olden days, people of northern part of Europe used this for whooping cough. And people of Sweden use this for throat infection and cough. Meaning, the remedy that I am going to unfold, or the remedy that I am going to show you now, had some medicinal properties, and it was used before we took it up into homeopathic practice. Okay. Now the remedy that we will be discussing today is Ledum talc. Okay. And the notes is ready. So simple request, please focus on the class. Okay. Notes I'll be giving it to you at the end of the class. Huh? So it's very important we have that eye contact. If you are all busy writing, I feel let out. Whom am I talking to? That becomes a question. So please maintain the eye contact. Then all of you focus on the class, and written notes will be given to you after at the end of the class. Okay. So we'll get back. Ledum talc is the remedy that we are going to discuss. Okay. Now from this, what do you see? What is Ledum talc? What is this? You have an image taken from Google Images. It is a plant. It's a plant. Yeah, naturally. A plant which is flowering. Okay, and white, etc. I will not look into that. See, if you describe this plant and if you start connecting that to our remedy, what is that called? What is that called? It is called doctrine of signature. We are not looking at the doctrine of signature part. Okay. So at the end of the session, meaning next 1 hour 30 minutes, whatever we are discussing, as a student, what exactly you should be getting is very important. So my class, I have just had some plans for you. At the end of the class, you as a learner, you should be in a position to list the common name, traditional users of Ledum PAL. This will be our first objective. And second thing, we'll also look at the habitat. I'll tell you what habitat is and how exactly Ledum PAL is prepared, the preparation part. Any wild guess which is the subject which plays a very important role in understanding this information? Very good. Homeopathic pharmacy. Okay. So we are trying to correlate the above with the knowledge of pharmacy. Okay. See, materia medica as a subject, if you study, it will be very, very boring. Okay. Then we have to integrate or we have to correlate materia medica with other subjects and try to understand materia medica, and this is the fundamental subject which is very, very important for you in your practice tomorrow. Done? So that's why wherever possible I will try to bring in cases. Okay, wherever possible we will try to give you some practical situations so that you understand materia medica better. Done? So common name, the plant, the source, all those things. This knowledge you will be getting mainly from pharmacy, knowledge of pharmacy. I'll explain a little later. See, and we'll also look at the sphere of action and pathogenesis. Okay. You want me to tell all this right now or we'll go after this slide? I'll explain, but see, these are all new words for you. And anything that is new is a pain. Okay, to understand. But once you understand, once you follow the rhythm, then it becomes very easy. So today's class might scare you. What is this sir trying to tell us? Pathogenesis, sphere of action, lot of new terms will come up. Don't panic. Don't give up. Focus, be attentive, and every word will be explained to you. Done? Okay? So mention the sphere of action, pathogenesis, integrate the knowledge of anatomy and physiology in better understanding of pathogenesis. I'll come to this. See, these are just the objectives, what I intend to teach you. Then this is just the beginning. Okay, picture abhi baki hai, just the beginning. Fine. So enumerate the ailments of Ledum. I'll tell you what ailments are, my first class. Okay, and we'll also list the characteristic symptoms of Ledum PAL. I'll tell you what this is, and describe the joint and injury symptoms of Ledum. We'll look at this. Okay, and yeah, the last part will be modalities of Ledum. I'll tell you everything in detail. This is what I have planned for next few minutes. Okay, so we will look at the first part, the introductory part. This is the image of Ledum. Okay, and I gave you the utility of Ledum before we took it up into homeopathy. Okay, now the entire Ledum, the remedy Ledum, we will be discussing under 3 broad headings. Done? The entire Ledum I will be telling you under 3 broad headings. What is the first heading? First heading is introduction. Now what do you understand by introduction? When you first came to Government Homeopathic Medical College, Bangalore, okay, I mean many teachers, they came, you know, they introduced themselves and you had to introduce yourself. Fine. So this is getting to know each other. Okay. So under introduction we have few headings, we have few simple headings. I'll be sharing those headings. Okay. And after introduction, now what is this image trying to tell us? Please have a look at the image. Thanks to Google Images, you know. Huh? No, see, don't use technical words. Tell me, what do you see, what do you understand from this image? There are flowers which are white. Okay, only one flower is red. So what is this? What is this? Don't you think it is something peculiar? Everything is white, but only one thing is red. Now this is what we in homeopathy look at as characteristic, peculiar, uncommon. Okay, rare. We'll look at that. So we'll be looking at the PQRS, very important. And then the last part is the particular symptoms. Okay, Ledum acting on the human body, where exactly it acts and what exactly it does is what we'll try to understand a little later. So 3 topics or 3 headings under which we'll be trying to explore Ledum PAL. All fine? Okay. See, this is only a build-up. We are yet to start. Okay, this is what I am trying to tell you what exactly I am going to teach. See, the full name of Ledum is Ledum PALUSTRE. Okay, which we call Ledum PAL. Fine. Ledum PALUSTRE, and the common name is marsh tea and wild rosemary. Okay. See, if you just Google, it is told that the leaves by few people, it was used as a tea. It was used for tea. The leaves, they were dried and they were had as tea, and that's why it has got this name marsh tea. And wild rosemary is the other common name. Now, what do you understand by common name? What do you understand by common name? Huh? Okay, what layman talk? See, for example, it might be a very vague example. You have some name, right? And your close people at home might call you with something. You might be Sanjay Gupta, is a rare, it's a name that just came to my mind. At home you might be called Bunty, Chintu, Pintu, okay, fine. Let's not go with the names. But yeah, I know. There are many. So what you need to understand is, see, common name. People, how they understand. They are not botanists or they are not scientists, fine? But commonly, what they call and why did they call with that name becomes important for us. Okay. See, this for a first year student can be MCQ. Now, NCH has changed syllabus. Okay. In the present syllabus, you will be having MCQs. So, common name of Ledum PAL. Marsh tea, wild rosemary A. Marsh tea B, wild rosemary C. Both D. None of this. You are getting my point? So it could be a MCQ. Nothing beyond that. No patient in the clinic will come and ask, Bhai sahab, Ledum ka common name kya hai? It is not important. Okay? We'll get back. And this is also, what is the part that we use? See, whenever we are looking at a plant, we are looking at an animal source, this question will come up. What is that part of a particular plant or a particular animal that is used in homeopathic preparation? For example, we use snake. Do you think we take the entire snake and we grind it? No. 6 feet, 3 feet snake in our small jar, mortar pestle, we do that? No. So what is it that we use in this snake? We use the venom, the poison. You're getting my point. So this entire snake is not used. Only the venom is used. Similarly, when you look at the plant, Ledum plant, the image which I already showed you, here the fresh plant, when it is flowering, see, there is an importance. Probably Sharnappa sir in your pharmacy class, he will try to tell you. Okay. In a plant, sometimes we use only bark, sometimes we use only root, sometimes we use only flower, sometimes only leaf, sometimes the entire plant. Fine? Done? So here, Ledum, the entire fresh plant is used in preparation. And the family it belongs to is Ericaceae. This is all the introductory part, the botany part. And source, it is a plant. And plant belongs to vegetable source. Plant belongs to vegetable source. Okay. Now we'll go ahead. This great man, you have seen his image many times. Fine. So he is the great man who proves Ledum. Okay. I'll just give you a small background. In homeopathy, there is somebody whom we call it as a master prover. See, in homeopathy, When we say Dr. Hahnemann proved Ledum pal, it does not mean only Dr. Hahnemann took Ledum pal. Fine? You should have this clarity. Ledum pal is given to women, men, okay, and people of different ages. And there is one master, meaning there is one leader who is looking into the entire thing. And that master prover is whom we give credit to. And Ledum master prover or Ledum pal was proved by our founder Dr. Hahnemann. Okay. Who proved Ledum pal? Fine. Dr. Hahnemann. That. So if you are very particular in 1825, see these things you can ignore. Age, year is not very important. Okay. So he proved, and now we will come to the important part of Ledum. Now Ledum is one of the frequently indicated medicines for injuries, skin affections, rheumatism and gouty complaints. Okay. So this is just the introduction. Any confusion in this slide? Though we have not spoken much, we spoke of what? The full name of Ledum, and the full name is Ledum PALUSTRE. And two common names I gave you. One is marsh tree and the second one is wild rosemary. And we looked at the part used, the entire plant when it is flowering. Okay. And we looked at the family is Ericaceae. Prover was Dr. Hahnemann. And it is a very good remedy in homeopathy. We use it for all these conditions. We'll explore slowly. Okay. We'll go to the next slide. Now what is this? What is this? What is this? Where exactly you see this plant growing? So this is what we call it as habitat. Where do you see? In the entire globe, there are few conditions which might be favoring a specific plant or a specific animal to stay there. Okay. Now that is what we call it as habitat. Habitat can sometimes be very helpful. Okay. For example, I mean when somebody talks to you about pulsatilla, I am just deviating a little here, but this deviation is important. When somebody talks of pulsatilla tomorrow, you see that the pulsatilla plant grows in a place which requires less water. You are getting my point? What did you understand? Pulsatilla grows in a place which requires less water. Okay. So what they have seen in pulsatilla patient, when they prove pulsatilla is, pulsatilla patient does not require too much of water. He is not a very thirsty guy. Fine. She is a thirstless female, meaning the amount of water they consume in pulsatilla will be comparatively less. So habitat, where it grows, under what circumstances it grows. Again, the pharmacy, plays a very important role in understanding this. Okay. So Ledum, basically it is seen growing in Europe, Asia, Canada and USA. Okay. We'll go ahead. Now how is it prepared? Preparation is tincture. The entire plant, it is prepared by tincture. You will explore all this in your pharmacy class. Fine? Okay. See, what I want you to understand is Materia Medica has to be studied in relation with other subjects. Okay. So the last part here, this entire information I have given, this has to be integrated with one subject. The knowledge of that subject is knowledge of pharmacy. So having a sound knowledge of pharmacy will help you in understanding the introductory part of any remedy. So is Ledum. All fine? Any confusion? Just the beginning of Ledum. Picture start हुआ है, fine? अभी खत्म नहीं हुआ है, अभी बहुत कुछ है. But start तो किया हम लोग. We have just started. So what have we started? I have introduced a remedy. Fine. I have given you the basic information about the remedy, where it was used before Dr. Hahnemann proved it. Okay. And what is the common name? what is the source, all those things I just gave you. Okay. Now we'll go ahead and we'll look at something very important. See, this is sphere, not spheres. Sphere of action. Now, any wild guess, as a first year student, what do you understand by sphere of action? Huh? Which part of the body the remedy acts, the drug acts? Good. Which part of the body the drug acts? Now, what is this? When a homeopathic remedy is given for proving, okay. So, based on the drug affinity, the drug can affect any part of your body. Fine? Okay? Done? So, when Ledum, under the leadership of Dr. Hahnemann, when Ledum was given, it was proved where exactly Ledum acts, on which part of the body Ledum acts. That is what we call it as sphere of action. All good? Behind sphere of action. Now, sphere of action of Ledum. If you remember, I purposely gave you a statement. What was the statement I gave you? Ledum is predominantly indicated in joint affections. Okay? Done? So what you have to understand here is a person to whom Ledum was given, he had issues with his joints. So sphere of action, Ledum affects the joints. First thing. Okay. Second thing, not only joints, it will also affect the skin. And the third very important thing you see is Ledum affects the circulatory system. I'll go slow, I'll repeat. We'll have frequent revisions so that the remedy is clear. Okay. So what is the heading we are discussing? Heading is sphere of action. So we just understood what we meant by sphere of action. Sphere of action means on which part a given drug is acting. So in Ledum, they realized Ledum has an affinity, or Ledum mainly acts on the joints, skin and circulation. So this is sphere of action. Now the second heading, a continuation that comes up here is, what will Ledum do acting on joints? Or what will Ledum do acting on skin or acting on the circulatory system? Fine? So the basic thing here is sphere of action. An extended thing of this, acting on the joints, what it is capable of producing is what we call it as pathogenesis. Two new terms. One, sphere of action. Sphere of action is which part it acts. Second point is acting on that part, what is the result? Is the joint getting inflamed? Okay? Or on skin, is it causing cancer? Is it causing simple eruptions? Whatever. That is what we call it as pathogenesis. Remember, each remedy based on its capacity can cause different things. Tomorrow when I talk to you about a different remedy acting on joints, it may cause something different, because that is the capacity of the drug. Here in Ledum, acting on joints, it will cause inflammation. Okay, it will cause rheumatism. Okay, it will cause rheumatism. See, rheumatism, new word. Rheumatism means when your joints, when your muscles, okay, when your ligaments, tendons, all those things, the fibrous tissue, when they go into an inflammation, we use a broad term, and what is the term is rheumatism. Okay. If you are not clear, make a note of all these new words till you get used to it. Okay. Refer. Done. You can look into some good English dictionaries, some simple dictionaries, and try to understand. There are dictionaries from English to Hindi, English to Kannada, your local language. You can make use of those dictionaries and you can understand things better. But for time being, for a first year student, Ledum acts on the joints and it will cause rheumatism. Rheumatism, first thing. And now the question is, as an anatomy student, you know there are plenty of joints. I don't know how much of joints are told in anatomy, but simple, what you realize looking at the skeleton in your anatomy lab, there are something called as small joints, there are something called as large joints. Okay. Ledum is a remedy which has an affinity mainly for the small joints. Okay. For example, metacarpal is what we call, and the joints of the legs we call them as metatarsals. Metacarpal, metatarsal, wrist. Sometimes it can also affect the ankle, the shoulder, the hip, possible. But predominantly it affects the small joints. Behind, all clear? Okay. So this is the first action that you need to remember. It acts on small joints and it will cause inflammation. The joints will be swollen, the joints will be painful to touch. This is what you see. So going ahead, what is its action on skin? Skin, you know, fine. What exactly Ledum is capable of producing on skin? It causes eruptions. Yeah, it's come there, eruptions, you know, small rashes, eruptions. It causes eruption on skin. Samajh mein aaya na? Third point, what we saw is circulation. When we talk of circulation, what comes to your mind as a first year student? Blood. Very good, beautiful, good. I am happy. Blood, circulation. So here, what happens in Ledum is, Ledum causes weak circulation. Ledum causes weak circulation. So what I will do is, when I start telling more about Ledum, you will understand the Ledum skin surface will be cold. What is it indicating? The Ledum skin is cold. What is it indicating?
Reduce the blood flow.
Very good. It is reducing the blood flow. So there is issues with the circulation. Fine? There is issues with the circulation. So what you see here is poor circulation. So there is coldness of the body. Poor circulation. So there is coldness of the body. We'll go ahead. Now, my question to you is, for better understanding of this particular component, knowledge of which subject is important? Very good. What made you think of anatomy? Because we are talking of organs, we are talking of structure. I use the word fibrous tissue, I use the word joints, I am using the word skin, I am using the word circulatory system. From where these things come up? From anatomy. Only anatomy? Physiology. Good. So knowledge of anatomy and knowledge of physiology is required in understanding the sphere of action and pathogenesis better. For introduction, did we need the knowledge of anatomy and physiology? What type of plant, where it grows, how you prepare, what is the part used? There we require the knowledge of pharmacy. Here we require the knowledge of anatomy and physiology. Done? Okay? So knowledge of which subjects, yes, you have answered this, and anatomy and physiology knowledge is very, very important. Okay. Okay. Now we look at the next part, and after this we will be having some quiz, some questions coming up, so that you will have more clarity. See, the next heading that I will be discussing will be ailments from. What is the first heading we spoke? Introduction. Okay. Under introduction, what did we discuss? Name, common name, part use, family, how is it prepared, who was the prover, okay, and where exactly you see this growing, habitat, good. So all these things will come under introduction. And second part we just spoke was sphere of action. All of you are clear with the meaning of sphere of action, and then the extension of sphere of action was pathogenesis. Pathogenesis, which means what is it causing? Acting on this, what is the result? That is pathogenesis. Two things. Three important areas you have to remember. One is joints, second is skin, and third is circulatory system. Done? All clear? We'll go ahead. Again, we'll have small breaks, small revision, so that you understand things better. Okay? Now we are looking at something called as ailments from. Any vague idea what exactly you understand by ailments from? Very good. What was that? Causation. Good. Causation. Cause. Why this particular complaint is happening in this particular patient? Okay. For example, what is the example we can think of? Cause. Like for example, I told you a small case. This girl was bleeding from her forehead. Okay. What was the cause for her? What was the cause for the bleeding? Scratch of a cat. Then the bleeding could be because of injury, the bleeding could be after a hit, it could be any damn thing. Now in this girl, the cause for bleeding was the cat scratch. Okay, so ailment means cause. I'll just give you the causative factors in Ledum and you'll understand things better. To start with, if you see this, the image is self-explanatory. One important cause in Ledum is alcohol. Okay. See, in this class, I have gone one step ahead and I am trying to give you what will happen in Ledum when they take alcohol. Okay. See, alcoholism in Ledum can give rise to headache, or it can give rise to cough. So tomorrow, how you apply this in your practice is, you have a patient who comes to you with headache. So what is the question you ask? Boss, what caused headache? Why headache? Not everybody who take alcohol will end up with headache. And alcohol is not the only cause for headache. I want you to understand this. Done? So this is what we call it as individualization. Somebody in your organon will tell. Okay? Somebody in your organon will tell. Every person, each of us, we are different. I scold somebody here. Do you think all of you will react in the same way? There are people, better people who have scolded me in a better way. Why the hell should I bother when you are scolding? But do you think everybody will have the same reaction? There is one girl or one boy here. Though I am scolding them, no, they feel hurt. Why because are they scolding me? Did I scold you? I am scolding somebody. They are so sensitive. They get hurt. I mean, each of us, though the stimulus, though the cause is same, what we end up can be different. Okay? In Ledum, alcohol will either give rise to headache or alcohol can give rise to cough. Somebody comes to your clinic coughing and you ask them, why cough? Not necessarily everybody will tell. Sir, alcohol, मेरे को Ledum दे दो. No. Nobody will come out. Not everybody will come telling, sir, last night I had alcohol and now you see in the morning in front of you I am coughing. Do you think alcohol is the only cause for coughing? Bangalore weather, it rained last night. You got wet or you got exposed to cold air. You might start coughing. You had ice cream. You might start coughing. There could be a number of reasons. In Ledum, I want you to remember, the cause for cough is alcoholism or alcohol. See, a peculiar thing you have in Ledum, complaints which come after haircut. Haircut is a normal phenomenon. When hair grows, many of us get it cut. If not for our sake, if you are very young, there is a pressure from the parents, from the school, get it cut. As you grow, you start having your own identity. You want to copy somebody, right? Or your girlfriend says, no, this is not the way you do. Aisa cut karo. I mean, what I want to try to tell you is something very natural. But see how a Ledum person will be reacting to haircut. Okay? Two very unusual things you find in Ledum. One, headache which comes after haircut. Again, I don't think we have so many of you 90 plus here. One or two might have issues. Sir, मेरे को होता है. Possible. Okay, and don't take Ledum. Okay. And another very interesting thing I saw in Ledum was hardness of hearing. If you just see here, he is shouting in a mic, and in spite of that he says what? He is not able to hear. Hardness of hearing which comes after haircut. Don't stare at me, how can this happen? But if at all somebody comes to your clinic, think of Ledum. Till date I have not got a patient with this scenario, but I have had patients with headache. I have had patients after haircut they feel giddy. Okay, after haircut they land up with headache. Fine? Never in my experience I have had, but it does not mean, it is not there. If you are lucky tomorrow somebody comes, sir, whenever I get my hair cut now, my hearing will go, down. I am not able to hear. Don't laugh at him. ऐसा भी होता है क्या? At least after learning homeopathy, anything can happen. Done? And Ledum. One more very important ailment or one more very important causative factor is colchicum. Colchicum is itself a remedy that you will be studying in homeopathy. But students who have already heard about colchicum, in olden days it was used for joint affections, for gout joint affections. Okay? So bad effects of colchicum. When somebody goes to a doctor with joint pains and that patient is been given so much of colchicum, okay, and he lands up with some issues, you can think of Ledum. You can think of Ledum. Okay? Are you all with me? Done? All clear? You want a small break? You are feeling it too much? Then we'll take a small break after this. Okay, but try to focus. Ailments from alcohol, ailments from haircut, ailments from colchicum. 3 ailments. Okay? We'll continue with few more ailments. Very important. Ailments from sharp instruments. Very important. This is what Ledum is famous for. There are many patients who come to your clinic. Ailments from sharp instruments. Can I have some examples? As a first year student, very good. Needle, injections, good. Syringe, good. Needle, syringe, glass, knife. See, I'm talking about, okay, sharp. See, for example, many times we have this nail. क्या बोलते हैं हिंदी में? Keel. When accidentally you step on it and it enters. Yeah, I know. And it's a very painful thing. Yeah, and as a medical student, don't feel. I'm not trying to tell you. See, there are two things: sympathy and empathy. You as a doctor should be empathetic. Don't be sympathetic. It happened. Don't take their pain, but understand their pain. I'm not asking you to be rigid, but don't get into the emotions. Right? And when I said make or kill, whatever you are talking about, a nail when it enters, I know it's a very painful thing. Okay, many of the girls are not able to even imagine. If you look at their expressions, they are already started feeling the pain. I appreciate, but as a first year student, slowly have to develop this. If you are not feeling, that is also very wrong. Start feeling. Many boys say, not feeling is also bad. Too much of feeling is also bad. You should have a balance. Fine? Okay. So beautiful things that you are trying to tell me, like simple thing. I just want to give you something practical as a first year student. I don't know if physios, when they start with your physiology lab, what is it? You'll be using this lancet and you'll be pricking, fine, to check your HP. Or you'll be using a syringe. Many times you would have seen the person, lab technician who comes to draw blood, he'll be drawing blood from a vein. Right? For example, accidentally he's not got the vein and he pricks your tendon, whatever. Fine? Fine? There you can think of Ledum. And somebody comes to your clinic in the evening and telling, Dr. Saab, today morning one guy came. He was not an experienced guy. He started, meddling here, there. See how much he has done damage. And it is paining. Fine? Fine? So now as a first year student, we have a beautiful remedy in homeopathy, and that remedy is Ledum. This is how we practically use it. Or tomorrow one of your friend, somebody pricks and also remember, I'll just share a small experience of my first year BHMS, way back 19, okay, so 1992, if I'm right, in the lab, when somebody's blood was drawn, we heard a huge sound. We heard a huge sound. One of the girl fainted. Not the girl from whom the blood was drawn. Okay? Somebody's blood, somebody's hand, somebody's drawing, and then we hear a sound and then we see what happened. Then one huge girl had fainted, creating a huge sound. So you need to understand, not necessarily everybody will have only pain. There are people who can faint looking at blood. And in homeopathy we have beautiful remedies. There are different remedies. Ledum will not faint. If somebody is fainting, don't go give them Ledum. And don't expect, kya hua, main kahan hu? That will not happen because Ledum is only for pain. Ledum is only for pain. Ledum will not faint looking at blood. But Ledum will have issues because of that sharp instrument. Somebody rightly said, because of the syringe, because of the needle, there can be a prick, and that prick can be painful to Ledum. Right? There, if you give Ledum, the pain will reduce. For example, a flower, rose flower, you have the thorn. When I thought some boy will tell sir that example, unfortunately, no issues. Will not go into the details. But for example, you have thorn prick, and that prick is paining. Fine? Ledum can be remedy. Fine? So nail, anything that is sharp, syringe, you can think of Ledum. So ailments causation from sharp instruments. Again, Ledum is a beautiful remedy for rat bite. Not only rat bite, insect stings. Like for example, what is this? Yeah, could be all those. Very important. I don't have a picture here. It's a very good remedy for snake bites. And I also missed one more very important thing here is, it is also a very important remedy for cat bites. Cat bites. I shared the case. What was the case? It was scratch, not a bite. Lucky. For example, if it was a bite, okay, you can think of Ledum. Cat bite, rat bite, snake bites, mosquito bites. See the variation. As simple as mosquito or as serious as snake bites. Okay? And ailments from... See, what I want you to understand as a first year student is, you have some skin rash and you apply some ointment. Skin rash disappears. Okay? Slowly as you understand more of homeopathy, you realize this we call it as suppression. Don't worry right now. But what you need to understand is, the skin rashes have gone, but the patient has developed with hardness of hearing, deafness. You are getting the situation? What is causing deafness in Ledum? Suppressed eruptions. Meaning, कुछ skin पे कुछ eruptions था, ointment लगाया, eruptions गया, उसके बाद he has hardness of hearing. You can think of Ledum. Or you see one more situation here. What is this that you see here in the image? there is discharge coming from the ears. Okay, discharge. You can make a note CSON. You can please refer assignment CSON. Chronic suppurative otitis media. CSON. When you have discharge coming from the ear. So this discharge is been locally treated, given some drops, ointment, whatever. Discharges are fine, but patient develops deafness. The remedy is Ledum. The remedy is Ledum. Okay? One last causative factor and then we'll take a small break if you want. What is that last causative factor we are looking at here is ailments from getting wet. There are many with umbrella, but this man unfortunately no umbrella. He's got wet. Okay? So after getting wet, they'll end up with headache. Each homeopathic medicine can have different complaints after getting wet. In Ledum, after getting wet, they will end up with headache. Okay? So before we take a small break, where do you see Ledum pal growing? What is the question? This question is mainly to do with habitat. So you saw, where is Ledum growing? Europe, Asia, Canada and USA. Very good. Okay. Second thing, what you see is, recall the parts on which Ledum pal acts. Joints, skin, circulation. See, the thing should be so clear that you should know this is where Vijaykrishna had projected an image, this was here, this was there. That is the kind of clarity you should have. Till you get that clarity, you will not be spared. You should get that clarity. Okay. Now good, very good. And third thing, what is the action of Ledum on joints? It causes inflammation. It causes rheumatism. Beautiful, good. Okay. Simple. Recall 4 ailments of Ledum. Alcohol, very good. Second, Indagada. Huh? Haircut, very good. I thought nail cut. Haircut, good. Haircut. Huh? Rat bite, snake bite, cat bite, bad effects of colchicum, getting wet, good. Okay. See, now beautiful question. Which type of materia medica has to be referred for knowing the sphere of action? Which type of materia medica has to be referred to understand the sphere of action? Go back to types of materia medica. I told you everything is interlinked. Your friend says one, pharmacodynamics. One more boy says physiological. Beautiful, beautiful, good, keep it up. Physiological materia medica and knowledge of pharmacodynamics by Richard Hughes, they help us in understanding this part of materia medica. Any quick questions? All fine? Okay. Next we will be taking about something important. Now, okay. Yeah, we will continue. Okay. See now, till now we spoke of the introduction, and as a quick recall, what we did was we spoke of introduction, under which I gave you the sphere of action, I gave you the pathogenesis, and we spoke of ailments now. Ailments now. Okay. Hope these things are clear. Any quick questions? All clear? Okay. So if it is clear, we'll go ahead and we'll be taking up the next part in Ledum. And if you look at the image which we just discussed, you see a lot of white flowers and one which is standing out, and that is the red flower. Now the idea of getting this image from Google is that the next heading that we are going to discuss is about characteristic symptoms. Once they do the drug proving, there are so many symptoms which will come up. You know, the result of drug proving will be symptoms. So when the master prover compiles all the symptoms that the remedy has produced, then you will be seeing that then there are few symptoms which are very peculiar, which are very characteristic. those symptoms are taken aside and they are given a separate heading, and that heading is what we call it as characteristic symptom. Okay. So in next few minutes we will try to focus on those symptoms which are peculiar or characteristic to Ledum. Okay. So one thing what you see is, you all know, it acts on joints. Acting on joints, it will produce rheumatism. Okay. Now in rheumatism, what becomes PQRS is what we are going to discuss. Now what becomes PQRS in this particular remedy is, in Ledum, the rheumatism starts here and it slowly goes up. You getting this point? So a Ledum patient tomorrow in your clinic might tell you, Doctor sir, my pains first started in the toe joints, yeah, and slowly it went to the ankle and then it went to the knee, now it is in the hip. Now what is this pattern that you see? That, yes, good, I am happy with the word. So what is the pattern you see here is, it starts down and it is going up. Is it peculiar or is it common? There are so many joints, it could have affected anywhere, no? It could have affected any joint. Why this pattern? Now this pattern is what becomes peculiar, and that's why in Ledum, under characteristics, we have mentioned ascending rheumatism as a peculiar symptom. So joint affection or rheumatism begins in lower limbs and ascends up. For example, you have a patient tomorrow coming telling, sir, it first affected my shoulder, now it has gone to my elbow, now it is the wrist, now it is the finger joints. Can you prescribe Ledum in that case? You getting my point? That will be a different remedy, and this is what we call it as descending, and in Ledum we have ascending. Please remember, ascending rheumatism. First point. Second thing, when I told you about injuries, when I asked you how many of you had injuries, many of you raised your hands. Did all of you have punctured injuries or penetrating injuries? Somebody said fracture, sir, my bone got cut. Somebody said, sir, I got hurt, this, that and all. All injuries you can't think of Ledum. All injuries you can't think of Ledum. Ledum has some peculiar characteristic injuries. And one simple example is, you have something called as penetrating injuries, punctured injuries. What happens when a sharp thing goes in? A sharp thing goes into your tire, it causes puncture. So punctured injuries is where Ledum is indicated. Tomorrow somebody comes to your clinic with fracture, okay, and don't expect, giving Ledum, the bones will start joining. Ledum 1 dose, it came close. Ledum 2 more doses, Ledum 4 doses. Bus, I am set. Bus sir, Ledum out. Fine. See, these are all not practical things. See, this requires a mechanical intervention. It is our limitation. 2 pieces of bones with homeopathic medicines we can't join. Fine. We can help in healing. We can give some medicines which will help in healing. But with medicines we can't join 2 broken things. It requires nut, bolt, screw, whatever. It is not our scope, it is our limitation. So, where in which type of injury Ledum gets indicated becomes characteristic. Okay. So punctured injuries, we saw this. I'll repeat this again a little later. Now the third very important thing is, what do you see here? Sprains. Beautiful. Good. I like this speed. The moment the image is shown, you say sprain. Good. Now what is getting sprained? Ankle. Easy spraining of ankle and feet. There are patients tomorrow who come to your clinic when you start practicing. They are prone to sprains. Right? Last week they came, this week again they come. Sir, sprain away. Right? Easy spraining of. Now why there is easy spraining of ankle joint? Again, go back to the sphere of action. It is a remedy which affects the fibrous tissue. It can cause weakness and it can cause spraining. So easy spraining of ankle and feet is a characteristic symptom. Now what do you see here? What do you see here? You see some discoloration. Okay? You see some injury and the injured part is discolored. So in ledum what you have is long remaining discoloration after injuries. Injury has happened year back, 6 months back, 5 months back, 4 months back, and the discoloration still remains. Okay? Many of you would have had injury. Week, 10 days it gets cleared. You are back with your normal skin. A ledum patient will have long remaining discoloration of the injured part, which is characteristic. Okay? Hemorrhage. I mean, if you just look at the image, some eye surgery is taking place. Okay? Now what I want you to remember is, again, knowledge of anatomy, anterior chamber, posterior chamber, when eye ball is explained, they will tell you in detail. I want you to remember ledum, if not me, when eyeball is told. Okay? Hemorrhages into anterior chamber after iridectomy. Some issue with the iris, and the eye doctor has decided that the iris has to be removed, operated. They operate, and if there is hemorrhage in the anterior chamber of the eye, ledum has a capacity. If you give ledum internally, it has a capacity to absorb that particular clot or that particular bleeding. Clear or confused? Should I go back? Is this part clear? Yes. This part? Rheumatism, specialty in ledum? Ascending. Injuries mainly? Puncture. Please remember this word, puncture. Tomorrow in a viva somebody will ask, describe or name the injuries of ledum. First word which is catchy is puncture. If you use the word puncture, it means for us, you know ledum. We might ask you, okay, enough, we'll go to the next question. That is the confidence that it will give to your examiner when you use the word puncture. That is the keyword. That is the keyword. Okay? So, this is where you are stuck. What is it? Eye operation, iris surgery is happening, and for example, if there is some small hemorrhage there, ledum when given homeopathically, it has the capacity to absorb that clot, that bleeding. Then, clear? Okay, we'll come back to it again after some time. Now I want your observation here. What is it that you observe here? Kindly focus, what is it that you see here? One is beautiful, one is, okay, don't use the word small, both are of the same size. One is thin, good, one is thin. Both legs, one leg is thin, the other leg is normal. The thinness, we use the medical word emaciation. Wasting of muscles, emaciation. Thinning. So, in ledum, for example, assume something has happened to this particular leg. For example, this leg has been injured or something has happened. This affected part will be emaciated. I'll repeat, the affected part will be emaciated. Ledum, characteristic. Okay? Now what do you see here? Bleeding. You see hemorrhages. In ledum, the hemorrhages are dark. What is this? In ledum, the hemorrhages are dark. And hemorrhages mainly coming from the nose, coming from the lungs, or through the uterus. I've used 3 words, we'll go slow. Hemorrhages coming from nose. The medical term we use is epistaxis. Bleeding from the nose. Epistaxis. It will be told by some other teacher, but keep this in your mind. Bleeding from nose is what we call it as epistaxis. Bleeding from lung. When I say bleeding from lungs means the sputum, the phlegm that you bring out while coughing, if this has blood, then we use the word hemoptysis. What is it? Hem means blood. hemoptysis, which is coming from the lung pathology. Okay, so in Ledum there can be bleeding either from the nose, there can be bleeding which is coming from the lung pathology, or a lady might have fibroid. Now what is fibroid? It's a small growth. I will not go into the technicalities of the word, but fibroid is non-cancerous tumor, non-cancerous growth in the uterus. Okay, non-cancerous growth in the uterus. So a lady with fibroid, she can also have bleeding from her vagina. Okay, right? And the hemorrhage in Ledum will be bright red or dark red? Dark. I use the word dark. Okay, so hemorrhages from nose, lungs or the uterus, which is dark. Clear? Okay, we'll go ahead and yeah, this is what I was trying to tell you. Is coughing blood, hemoptysis, alternating with rheumatism. What do you understand? Hemoptysis alternates with rheumatism. Meaning, alternate means what? When the patient is having hemoptysis, he will not have rheumatism. When he is having rheumatism, he will not have hemoptysis. Meaning it is alternating. Sir, see, right now I have hemoptysis. Okay, hemoptysis will stop and then the joint complaints will start. It alternates. Okay. Now what do you see here? She is feeling cold. Can somebody quickly interpret why is this lady feeling cold?
Reduced circulation.
Beautiful. Reduced circulation. From where did you get this point? Reduced circulation? Sphere of action. What was the sphere of action of Ledum on circulation? It is decreasing or weakening the circulation. See, when the circulation is weakened, what will happen? There is coldness. Right? And when there is cold, what will happen? You want to keep yourself warm. Now this is the interpretation. Okay? Good. So complaints of people who are cold all the time. All the time they feel cold. From lack of animal heat. Now blood is something, if you read the circulation, which will be told in physiology, it is something which generates heat. Okay. So that heat will be absent. So they start feeling cold. The wounded parts are also cold to touch. I told you, Ledum is a very good remedy for injuries. The injured part is also cold to touch, which is characteristic. Okay? Okay. One last characteristic symptom. What is the last characteristic symptom? See, there is something called as diagonal. What do you understand by diagonal? Crosswise, no? Opposite. So there is one diagonal affection in Ledum. And what is the diagonal affection is? It affects the left shoulder and right hip. Done? So they will have pain in the left shoulder and they will have pain in the right hip. Now this is what we call it as diagonal affections. See, some other remedy might have right shoulder, left hip. Can we give Ledum? No. In Ledum it is very specific. Left shoulder, right hip. This is the clarity you should have. Okay? This is the clarity you should have. Okay? So, the characteristic symptoms I mentioned. Right now, we will have some small questions so that I will understand how much of characteristic symptoms you have understood. If you are not able to answer the questions, we will again go back and start with the explanation. Okay? So boys from behind, in others please, I know it is very tempting. Boys from behind, in what type of injuries Ledum is indicated? Don't calm them, they know. What type of injuries we think of Ledum? Very good. One word, all of you. One word is puncture. Or I also use another word, penetrating. Good. Penetrating. Good. Very good. And second question goes to the girls behind. Ledum is indicated in descending type of rheumatism. Girls behind? True or false? Why false? You are getting my point? Small revision so that you feel confident and comfortable. Okay. Now the third question will go to the girls in the front. Why are Ledum patient cold always? I didn't ask this question to this boy because I know he answered this a little while ago. So Ledum acts on circulation. It is weakening circulation. There is decreased supply of blood which is causing coldness. All clear? Okay. One last question. Okay. Hemoptysis in Ledum alternates with rheumatism. Alternates with rheumatism. Okay. So this was the small recap. Action of Ledum on ankle joints. It causes easy sprain. Yes, good. Pick easy. Good. Keep it up. So this was a small recap of the characteristic symptoms. Any other characteristic symptoms that we have missed here? What is it that we have missed? Hemorrhages from where? Nose, lungs, fibroid, uterus. Huh? Diagonal affections. Good. Left, shoulder, right hip. First ऊपर उसके बाद नीचे. Left shoulder, right hip. Yeah, beautiful question. Which type of materia medica helps in understanding characteristic symptoms? Huh? Which type of materia medica will help us in understanding characteristic symptom? I gave an example in the last class. What is it? Allen's keynote. Where a materia medica. Good, very good. It is called as keynote materia medica. Where only characteristic symptoms are given. See, now after class what you do is, you go back to library, you open physiological materia medica and you see if Ledum is mentioned there and you read it once. Okay. That will give you more confidence. Second thing you will see is, you will read Allen's keynote, open, and you will just cross check if I have given you all the characteristic symptoms. Done? Okay. So any questions or shall we move to the next part? I told you Ledum will be discussing under 3 headings, if you remember. The first heading was introduction. That is clear. Second heading we spoke was characteristic symptoms. And third heading was particular symptoms. Now 3 headings. See, what I told you is broad classification under which I will be explaining Ledum to you. Introduction, characteristic symptoms, and particular symptoms. We are done with introduction. All of you are clear? We are done with characteristic symptoms just now. Okay, and now we will be focusing on particular symptoms. So what is a particular symptom? What is a particular symptom? Yeah, it is denoted by mind. And particular symptoms are symptoms which are pertaining to a part. And what are those 2 or 3 parts that's very important for us in Ledum? One will be joints, good. Second will be skin, under which we will be discussing injuries. And last thing is, okay, circulation, good, okay. So we will focus on the joints, a 5-mark question for you in your exams. And then we will be focusing on skin or the injuries. And then the last thing we will be doing here is, we will talk of modalities. What do you understand by modalities? Aggravation and amelioration. Modalities could be particular or it could be general. I'll explain. Particular or general. Good. So we look at the first part. See, now you can answer all this. What is the confidence that with what confidence I am telling you can answer all these things is because sphere of action is clear, ailments are clear, and then characteristic symptoms are clear. Now it is only application of all these things under particular. So there is a question that will be asked in your exams. Describe the joint complaints of Ledum. Okay? Describe the joint complaints of Ledum for 5 marks. Okay? Now how are you going to write? There is a systematic way of writing it. Okay? First thing what we do is we start with sphere of action. So what is the sphere of action that is relevant for us under joints? We are talking of Ledum action on small joints its capacity to produce inflammation. So the first point will be for you is it mainly affects the small joints. Ankle, heel, metacarpal, metatarsal, causing rheumatism. Okay? 5 marks question. And the next point, what you can also write is, acting on all these things, it is causing rheumatism. See, there is something. Now, first heading is spear affection. Second heading will be location. Out of all these joints, which joints Ledum will mainly act? Small joints, metacarpal, metatarsal, we saw that. It can be ankle, it can be wrist, or it can be shoulder, or it can be hip. Though they are large joints. And of course the knee. Of course the knee. So you can write all these things. And what was this which was very peculiar in Ledum? Yeah. So what did we call this? Diagonal pains. Left shoulder, right hip. You can write that. And then the other heading, spear affection, location, the other heading will be character of pain. When they have joint pains, each remedy might have their own specific pains. In Ledum, how are the pains? So now this is what we call it as the character of pain. One you already know, the pains ascend. You can write ascending rheumatism. And the pains which keep shifting. Pains which keep shifting. And pains which are tearing. When you ask the patient, how is the pain? He says, sir, as it's been torn. Tearing pains. Pains which are violent. Violent. Both are there. Violent is intensity. How strong the pains are. Pains are violent, tearing, and having diagonal affection. You just saw this. Having diagonal affections. Okay. See, when we say, it is a very good remedy for the metatarsal joints. As a first year student, it might be a little difficult, but then tomorrow in your clinic, many times we see people coming with the great toe. I am showing you the finger. Great toe will be swollen. Great toe will be red. Very painful. They will not allow you even to touch. Very painful. Okay. There, one condition should come to your mind. And that condition is what we call it as gout. Gout. G-O-U-T. Gout. Now what is gout? In gout, there will be deposition of uric acid in joints, mainly in the great toe. Clear? So Ledum can be a very good remedy for gout. Rheumatism, gout. Okay. See, I have written this in the text form here. Good remedy for gout and rheumatism. The affected joint is swollen. Okay. Any questions here? Joint, how is it we are trying to explore the joints? We spoke of spear affection, affinity for which joints. Acting on these joints, what will Ledum cause? It will cause inflammation, rheumatism. Then we also looked at the character of pain. Diagonal pains, pains which keeps shifting, ascending, violent, tearing. Okay. And again a very good remedy for gout. Where the great toe is affected. Okay. Now what do you see? Pain in knee. Shooting pain in knees while walking. I have given all this in the note. Shooting pain in knees while walking. Okay. And then this is a small pictorial representation of ascending rheumatism. It starts here and it goes up. Ascending pain. And one speciality in Ledum is the pains are better by cold application. The pains are better or ameliorated by cold application. So here you see a patient with ice cubes, keeping it on the knee, and only then she is able to walk. Okay? Can move joints only after applying cold application. Okay? Now, when the pains aggravate, Modalities. So when we say cold, you know it is opposite warmth. Warmth. So aggravation night, if you are looking day, evening, night, and aggravation heat. Aggravation warmth of bed, meaning bed generates good amount of heat. That heat can increase the Ledum joint affections. Okay? Touch aggravates, movement aggravates, and one last thing is evening aggravation. Evening aggravation. Evening, night, heat, warmth, touch, movement. These are all the aggravating factors in Ledum joint affections. What ameliorates? Yes, good. Better by applying ice cold water. Better by applying ice cold water. Okay. See, one last heading in Ledum under rheumatism or under joint affection is, see, you also saw something which was peculiar, which was concomitant. What did I mention? When they have, what was alternating in Ledum? Rheumatism alternates with hemoptysis. Hemoptysis, no issues. Rheumatism alternates with hemoptysis. That could be one. We saw that. And one more very important thing is cataract. Now what is cataract? Very good. Deposition. Yeah, no issues. It is a degenerative process where there is deposition on the lens. Many times you should have heard of cataract operation. They remove this lens and they replace it with a new lens. So in Ledum, you have cataract with gout. You have a patient who is having cataract and is also having gout. This combination, cataract with gout, you can think of Ledum. Okay. So tomorrow in your exams, joint affections, or tomorrow in your practice, joint affection, key points you need to remember is which joint, character of pain, what aggravates, what ameliorates, and with rheumatism, what are all the other things that are possible. Okay. Yeah, now I will be talking of injuries, last part of Ledum. But before I take up injuries, any questions in the rheumatism, joint affections? All of you? Clear? So we will talk of injuries. Now injuries, before I start telling, you can start contributing. What injuries? First thing is punctured injuries, good. Penetrating, punctured. Injuries with pointed objects, sharp injuries. You can give some examples, like for example, syringes, needle, lancet, nail, okay, thorn, good, okay, shooting, okay, sharp things, you can do write that. Then what else? Yeah, very good. You can talk of insect bites, good. You can talk of rat bites, you can talk of cat bites, fine. Mosquito bites, good. These things you can talk of, very good. What else? Good. Snake bite also, very good. Go back to the characteristic symptoms, go back to the ailments from, go back to the sphere of action and see if you can contribute few more things. Alcohol. But what has alcohol got to do with injuries? Alcohol injuries in Ledum. Alcohol is a causative factor, agreed. But we are looking at injuries. Okay, pains, the injuries which are painful, good. We spoke few more things under characteristic symptoms. Where is the location of injury? Okay, it can be in places which is rich in nerve supply. For example, fingertips, possible. Then. You saw a few more things under characteristic related to injuries. What is that, anybody? Okay, I have sprains, insect burns. I have shown you an image where there was discoloration. And what was the speciality of discoloration in Ledum? Discoloration which remains long after injury. And the affected part is cold to touch. cold to touch. So these are few things. So I'm just giving you the location. It can be eye, it can be sharp instruments, it can be punctured wounds, it can be mosquito bite. See, this is also very important. Contusion. What is this? Contusion. Ecchymosis. Now, the word ecchymosis means when you have, accumulation of blood, clot. For example, some girl was using the word bruise. When there is a bruise, you see some black discoloration, some blood underneath. This is what we call it as ecchymosis. Ecchymosis. Right? So after a blow, if there is blood, black eye, ledum can be useful. So contusion of the lids and the eyes. Again an image showing ecchymosis of the conjunctiva. Can you see this? It is white here and it is red here because of some accumulation of blood. Okay? Ecchymosis, injuries, the cause for injuries here will be with needles, syringes, lancets, etc. And one keyword will be punctured wounds. And where is the location? Injury, it can be anywhere. It depends. It's your luck. It can happen anywhere. And it can happen over eyes. It can happen in the anterior chamber of the eye. What is the cause? After iridectomy. And the result is hemorrhage. Okay. Pain as if bruised. The injured part is very painful. Pain as if bruised. A better remedy, Sarnika, this is your first remedy, so I will not go with comparison. Long remaining discoloration after injury. Black and blue parts turn green. Parts are very cold to touch. And when is it more? The modalities. Aggravation, amelioration. Amelioration is by applying cold things. So this is with the injuries, and this will be the general modalities. When the complaints aggravate in ledum and when the complaints ameliorate in ledum. Joint complaints better by placing legs in cold water or ice water. Okay? Cold water. Ice cold water or cold water. Okay? Now, one last revision so that we can end ledum, provided you have understood ledum. Where is the location? Joint pains. Location. Where? Small joints. Good. Small joints. What is the character of pain? Ascending, shifting, tearing, violent. Tearing, good. So that is the character of pain. When is it more? Night, evening, warmth of the bed, good. Touch, movement, evening, night. What ameliorates? Cold water. And joint complaints associated with or alternates with hemoptysis or cataract associated with gout. So this is joints, which you will have to elaborate. I have just given you the key points as a revision. You will have to elaborate and you will have to write in your exams. Now injuries, a quick revision. Type of injuries, puncture, good. See, we have discussed a number of times from last 1 hour. Puncture, remember that. And character of injuries, okay, discoloration which remains long. Okay, and the affected part, the injured part is cold to touch. Okay, so this is all about ledum. And before we close, this is what we started. At the end of the session, the learner is able to, will be able to know, is able to list the common name. Common name? Marsh tea, wine, rosemary. Before it was used for throat infection, cough, bronchitis, good, whooping cough, bronchitis. That was before Dr. Hahnemann proved. Okay. And second thing is habitat. Very good. So, and preparation, tincture. Okay. Yeah. And they will be successful in correlating with knowledge of pharmacy. Okay. And it's very important. And then sphere of action. Three things should come. Joints, skin, circulation. On joints, inflammation, good. On skin, eruptions. On circulation, weakened circulation, good. Okay, good. Enough. And yeah, this we try to integrate with knowledge of anatomy and physiology. Okay. And ailments, quickly, what are the list of ailments? Alcohol, lot of bites, these are lot of bites, getting wet, colchicum, and colchicum specially for joint affections. Okay, colchicum specially for joint affections. Then, getting wet, huh? Yeah, sharp instruments, injuries, haircut, good. What will happen because of haircut? Headache or hearing, issues with hearing. And we also saw suppressed skin eruptions or suppressed discharge from the ears, CSY, okay, good. And characteristic symptoms, hope this is clear. Then, and then we spoke of specifically joints and injuries. And the materia medica which will help us in understanding the particular symptoms is mainly, particular symptoms is mainly anatomical materia medica. Anatomical materia medica. Okay? Fine? These are examples. What was the examples? We had Hahnemann's materia medica pura itself is an example for anatomical materia medica or schematic materia medica. Okay? And last thing we saw was modalities. What ameliorates? Cold. And ice cold application. Okay? Fine? And coming back to that case, cat scratch. Okay? One of the girl was telling in the break, sir, but you told it is cat bite. So we can't ask the patient to come back after cat bite. बाद में आना कटवा के आना we can't do that, but what typically happens is, see in allopathy they give TT, okay, they give tetanus toxin. I forgot to mention, or I wanted to mention now, that Ledum is one remedy which can prevent tetanus. So your assignment will be understand what tetanus is. Okay? So kindly read what tetanus is. It is a very dreaded disease. It can cause spasms of muscles. Tetany is different. See, tetany is because of deficiency of parathyroid hormone, calcium, parathyroid hormone. Tetanus is mainly because of a bacteria, Clostridium tetani. That is what causes tetanus. No issues. Now please understand, Ledum can be like tetanus toxide, like your injection which is given to prevent tetanus. Okay. So immediately after a person comes to you with a rusted nail and accidentally that gets in. Okay. Fine. So our remedy Ledum can do wonders in preventing tetanus. Okay. So this child, if it was not me, if they would have taken to an allopath, the allopath would have given her a tetanus shot. Okay. So we in homeopathy, though we also did the cleaning and all, washed with water, everything, we gave her Ledum. Ledum 400, one dose was given. Okay. The idea is, if at all any bad effects happen, Ledum will nullify the bad effects. Okay. So under injuries you can also add Ledum can be a remedy which can be used as a preventive for tetanus. Preventive for tetanus. Okay. So hope it's clear. All clear or any quick questions? You're okay with the speed? Understood? Ledum, boys? Done? Okay.